I'm Dr. Wayne Kuang from Man vs. Prostate and the BPH 360 podcast. Let's talk about your symptoms today that too many men are having from their prostate, BPH, as well as from their bladder, OAB. Something you need to know is that there's only two major organs you can't transplant, your brain and your bladder. You only get one bladder, so we need to take care of it. Your heart's a muscle that pumps blood. The bladder is a muscle that pumps urine through the prostate that starts off about the size of a golf ball, but in the shape of a donut. And as men get older, that prostate gets bigger and that donut hole gets tighter. As a result, we need to talk about this in some way that we all can understand. And we know that from cancer care. We talk about the stages of disease because BPH can also progress over time to more serious and more urgent stages. As a result, we created the 5 stages of bladder health. And you can actually see it right here. And what this is it talks about the progression of disease that you or a loved one might be going through. So stage 1 is where that prostate donut hole is getting tight and things are slowing down. Then over 5 years, 10 years, 15 years, that bladder muscle is now squeezing harder and harder, working harder, struggling, quivering, becoming overactive. As a result, you're having symptoms of urgency, frequency, nighttime urination. And that's stage 2 where the bladder is becoming overactive. And then stage 3, if you don't take care of it, just like you're a rebellious child or a bladder that can squeeze without your permission and actually can cause you to leak on yourself. And we call that urgency incontinence. And if you really don't take care of it, just like the heart can have a heart attack, the bladder can suddenly stop working and you show up in the emergency room because you can't pee at all. You can't pass your urine. And now it's a crisis because they have to place a catheter into your bladder to drain all that urine. And then stage 5, just like the heart can go into heart failure, the bladder can go into bladder failure. And now you might need a lifetime of catheters. Worst case scenario, the heart can still be transplanted, the bladder can't. And that's why this conversation is really important, that if you're having those symptoms of BPH, things slowing down, but also OAB, those are all symptoms that you need to talk about with your provider. As a result, to help you, to give you real tools that you can bring to your doctor, we've created a modification of a tried and true academic symptom score called the IPSS. And now we've modified it to be the IBPSS. B is for bladder, P is for prostate, the International Bladder and Prostate Symptom Score. It's now in 15 languages worldwide. And what we've done is reorganize the questions so that now you have a sense. This first section is about your BPH, the donut hole tightening down. So these are the symptoms like a weak flow or starting and stopping. And then the second part is the bladder, the OAB, stage 2, urgency, frequency, nighttime urination. But then what we did, the magic is we added a question about stage 3, are you leaking, urgency incontinence, as well as stage 4, if you ever have had acute urinary retention, a really fancy word for have you ever been unable to pass your urine and had to go to the emergency room to have a catheter. So you can see this is a vertical framework to help mirror this horizontal stages. So now you can diagnose kind of where you are now and see where you are in the present and potentially where you might be into the future. Now, obviously, this does not substitute as a diagnosis. It's just part of a conversation. It's a tool to help you clarify what's going on in your bladder and in your prostate for BPH and OAB, so you all can figure out what are the best management strategies for both BPH and or your OAB, and whether or not to pursue diagnostics to get the right data so you can make better decisions so you can live the best version of your life, incontinence-free and catheter-free.